Welcome everybody, this is your buddy and fellow nurse Ash, and today we'll be talking about wound sampling. There is a lot of doubt that nurses have about taking the samples of the wound, and some think it's very easy and they don't need to have a proper knowledge to take a sample of the wound. And today I'm going to go in detail and give you the right way to take the sample of a wound. So as you can see, I have a beautiful picture of a wound right here, and since I don't have a wound, I'll be using this picture to show you how to take the sample of the wound. The first and the foremost thing which you should know for taking the sample of the wound is to clean the wound properly. This is the first misconception I've heard from many nurses. They don't want to clean the wound. They think if they take the sample of the wound, without cleaning the wound, they will be catching more germs, and then it'll show in the cultural insensitivity more, and it's going to be more effective, which is completely wrong. Because if you do that, the samples will not give you the right bacterial colony that we actually need. And the reason for that is there is debris. There is some of the chemicals that you have used from the previous products that stays on it, and that affects the wound sampling. So the best method to take a sample of the wound is to clean the wound. And we all know this small 118 ml of bottle of normal saline that we always use, and it comes with a nozzle for a reason. If I'm taking sample of a wound, I just wash the wound completely with the whole bottle because I don't want anything to be there. And I clean it properly, I wash it properly. Sometimes I go from far so that this nozzle sprays on it. It will only going to generate 15 to 20 pascals of pressure on it. If the patient feels pain, you can totally avoid that. But if you're not in the pain, just clean the wound properly before you're going to take the sample of the wound. To take the sample, you will get something like this. And when you open this, you will see that it comes with a test tube kind of container and one in which we collect the samples from. So if I want to collect the sample of the wound, I've already washed the wound. If the wound is something like this, which has eschar tissue, which has slough in it, and also has granular tissue, another misconception is that usually people go in the slough and then they take the sample from there. That's not going to give you the right sample. The right sample can be taken only from the healthy granular tissue that you see. And what's a healthy granular tissue is the beefy tissue, the good tissue that's in the wound. We want to take the sample from that area so that we collect the right sample. And the best way to collect the sample as per the research is called Levine technique. And what is a Levine technique? So there are many ways I can collect the sample of the wound. So some people prefer to just do that. If I do this, I am not collecting the right sample from the wound. I'm not collecting the right colony from the wound. The best way to collect this is you go into the granular tissue, you press on it, go 1 centimeter deep, and if there is exudate, let it soak in to your swab, and then you rotate this one 180 degrees or 360 degrees. So this is how it should look like. If the plastic portion bends, let it bend. Another tip I'm going to give you, you don't only collect the sample at the tip of this swab, you collect it on the side too. And the reason I'm saying is that when the lab people, they use the petri dish to spread this, they usually don't spread it like this to collect, to grow the colonies and see the sensitivity. They usually do it in this manner. So if I'm giving a good sample of the wound, I should be also collecting the samples on the side as well, so that when they're spreading, they would be collecting a good culture of bacteria in there. Once I have finished this, I'm going to open this up and I can put this directly and then just close it. And this can be sent to the lab for culture and sensitivity. Suppose the wound is so dry that even after washing it with normal saline, you are not able to clean it, it still remains dry. In that case, this one has a solution in it. I do not know the name of the solution, But you can dip your swab in this. It's wet now, and then you can use this to collect the sample so that it can also collect the sample from the dry area. Few things to remember. If the patient is on antibiotic, the samples may not give the right answer. So you collect the sample either before starting the antibiotics or once they have stopped the antibiotics, wait for 72 hours to give you the right results to take the sample of the wound. Do not be afraid sampling of the wound. It is important for us to know why sampling of the wound, what culture, what bacteria are living in there. In my other sessions, I would also go about biofilm. What is biofilm and how we can close or how we can interrupt this biofilm to for a healthy growth of granular tissue to close the wound. So I'm just going to repeat everything that I wanted you to remember. Always wash the wound. Take the sample from the granular healthy tissue, which are beefy red tissues, not from the slough or not from the areas you think has more dirt and bacteria in it. Always collect sample from the tip and also from the side, and the technique that you should be adopting is going to be Levine's technique, in which we go 1 centimeter down and then you rotate. You take the collect sample, and if you imagine it like a colony of bacteria of that region is going to come in it. It's going to deposit itself in it, and then you give it for the sampling. And that's how, my friend, you'll be taking the samples of the wound. Thank you.